www.healthcmi.com. Acupuncture Continuing Education Online. Hello, I'm Adam White, licensed acupuncturist. Today, Acupuncture and Herbs COVID-19 Coronavirus Findings. This was published March 23rd, 2020 at healthcmi.com. Simply go to healthcmi.com and click on News. Acupuncture and herbal medicine are effective for the treatment of COVID-19. That's coronavirus disease 19. The Beijing Health Commission notes that 80% of COVID-19 patients in Beijing receive traditional Chinese medicine treatment, that is acupuncture and herbs. The commission documents that a total effective rate achieved a 92% total effective rate for that using acupuncture and herbs. Now, please keep in mind, a total effective rate means people had significant improvements. It is not the cure rate, which would be a monumental achievement if we could get that. So Gao Xiaojun, spokesperson for the Beijing Health Commission, announced that Chinese medicine practitioners will determine Chinese medicine treatment plans for newly diagnosed, affected, severe, critically ill COVID-19 patients. In a formal announcement, Gao Xiaojun cited a brief history of one coronavirus patient suffering from fever. Again, COVID-19 is just short for coronavirus disease 19. 3 TCM experts from Dongzhimen Hospital and Yitian Hospital formulated and administered a TCM treatment plan, and by the next morning, the patient's temperature dropped significantly to 37.2 degrees Celsius. So patient, again, having high fever, and they're able to get it come down. It was in a public announcement, he was citing one case. And then the spokesperson added that there are many similar cases, and the Chinese medicine has, quote, played an active role in improving the cure rate and reducing the mortality rate. The Beijing Health Commission has established city, district, and hospital level TCM expert groups to establish treatment protocols for the prevention and treatment of COVID-19 patients. And the National Administration of Traditional Chinese Medicine also published some research using the herbal formula Qingfei Baidutang. They had a 90% response rate. Again, that's a total effective rate out of 214 patients. Out of the 90% of people who did respond, symptoms markedly improved in 60% of patients, and the remaining 30% stabilized. Li Yu also announced, again, in that public announcement, research that had been finished, and it was of 701 COVID-19 patients treated with Qingfei Baidutang. 130 patients of that 701 were cured. So again, not a perfect cure rate, but not bad. Symptoms, including fever and cough, completely resolved in an additional 51 patients, and symptom improvements occurred in an additional 268 patients. Stabilization occurred in 212 patients. So some progress is made with that herbal formula. Go to healthcmi.com. There is yet another article that gives you all the herbal medicine ingredients of that formula. In a detailed analysis of 351 patients, Liu notes that 112 patients had a body temperature in excess of 37.3 degrees Celsius after taking Qingfei Baidutang. For one day, 51.8% of patients' body temperatures returned to normal. After 6 days, 94.6% returned to normal temperature. Same for coughing. 214 of the 351 had coughs after one day drinking Qingfei Baidutang. 46.7% of patients' coughs completely resolved, and after 6 days, 80.6% had significant reductions in coughing. In related findings, also Lianhua Qingwei capsule also helped resolve COVID-19. If you go to the website, you'll see all of the research is referenced here, and there's a lot more details and clinical information. We have also published the Acupuncture Treatment Guidelines for COVID-19 second edition, published by the China Association of Acupuncture and Moxibustion. So you can go there and see all of the formally recommended acupuncture points. And we also published in the same article information from the Beijing Hospital of Traditional Chinese Medicine and how they got results for the 2003 SARS coronavirus, which is a different strain in what they did and how they achieve results. So some of the successes that are being achieved today are because they've had some prior experience in 2003 with a similar outbreak in that it has the same root. So again, coronavirus, if you want to learn more, go to healthcmi.com. We have another article there entitled Chinese Herbal Medicine for COVID-19 Coronavirus Treatment. And that one gives you kind of how to prevent its spread, how long things last on surfaces, and just very briefly, 3 hours in aerosol form, 4 hours on copper, 24 hours on cardboard, and 2 to 3 days on plastic and stainless steel. And all kinds of information like that is in that article, along with the details of the herbal formula, Qing Fei Baidu Tang. So that is a great resource, especially for licensed acupuncturists who want to help patients. Keep in mind, we also have Jeffrey Pong's continuing education course on influenza, which may be helpful because some of the herbs like Sanyahu, for example, can bring down that high fever. And so even though that's a completely different virus, it is a good source of information to take a look at that. And again, the Pong family, having formed the Five Branches Institute of Traditional Chinese Medicine's curriculum and having for many generations been doctors in China, also in Hong Kong, and now in California. I want to thank you all for listening, and keep in mind that we'll have continued updates at healthcmi.com, so stay in touch and stay healthy. Thank you for listening. www.healthcmi.com